Good morning, everyone. Today is Friday, June 26th, and we are the Standing Committee on Health and Social Development. And just to kind of give you a brief overview of what the committee is charged with, we are charged with matters concerning health, social programs, sports, seniors, justice and public safety, emergency measures, Indigenous affairs, Francophone affairs, and Acadian affairs, status of women, persons with disabilities, housing, charities, the Prince Edward Human Rights Commission, and all other matters related to health and social development. So, good morning to Hilton McLennan, Carolyn Simpson, Brendan Curran, and Carla Bernard. So, we are here this morning to receive a briefing on Accessibility Supports Program from the Department of Social Development and Seniors. And this morning we have with us Executive Director, or Acting Executive Director, Shelley Cole, Director of Social Programs, Ann Drake, and Manager of Strategic Initiatives, Jessica Walker. So thank you, ladies, for coming in today. And finally, the sun is going to shine. So hopefully we won't keep you too long so that you can enjoy some of it. So I'm going to turn the floor right over to you. We'll ask you to state your name for Hansard, and you can start with your presentation.
Okay, great.
Oh, we didn't adopt the agenda. Can I have somebody to adopt? Thank you, Carolyn. Now we can turn it over to you.
Okay. Hi, Shelley Cole, Executive Director, acting for the Department of Social Development and Seniors.
Ann Drake, Director, Social Programs. Jessica Walker, Manager of Strategic Initiatives.
All right, so we're really pleased to be here today. We really are. No, we really are. There's some topics that you invite us to present on that are less exciting for us, but this one is certainly one that we've put a tremendous amount of effort into over an extended period of time, and we feel really hopeful and positive about what we are bringing forward in terms of recommendations in the reviews. And so we're excited to be able to come here today, not only to share information with you, but to provide an opportunity for you to ask questions that you may have. So after an extensive consultation and review period where we worked with an experienced, skilled, and knowledgeable consultant in Davis Peer Consulting, the reports for both the Accessibility Supports and Residential Services programs were released on June 1st, just about nearly a month ago. And in today's presentation, we'll share information with you about the Accessibility Supports and Residential Services programs, so we want to make sure we have a good grounding of both those programs. We're going to share details on the scope of the review, the public engagement that was undertaken, what we heard, and some of the themes that emerged. We'll share recommendations, we'll talk about our expected outcomes, timelines, considerations, and we'll provide plenty of opportunity for questions. So first, we'd like to acknowledge that the Accessibility Supports Program is the province's flagship program for supporting persons with disabilities on Prince Edward Island. It's an incredibly important program and one that is both challenging and complex to deliver. The program has seen exponential growth since its beginning in 2018, 63% increase in caseload growth. And additionally, the cost per case for this program is ever growing, presenting additional staffing, resource, and budgetary challenges. And those staffing challenges are not limited to the department, and we'll share some of that information with you as we go through the presentation. The needs of our clients span across the responsibility and mandate areas of multiple departments, including health, education, justice, thinking really specifically about the public trustee, the public guardian. And in many cases, multiple departments are supporting the same clients. So we're supporting mutual clients. And so this provides both opportunities and challenges, and some of those opportunities and challenges are around responsibilities, collaboration, information sharing, and resource allocation. We're mindful of this challenge, and we are actively working to enhance collaboration and communication, both within government and with the community. From the beginning, when this program was first introduced in 2018, it was never intended to duplicate or replace existing resources that are offered throughout government or by community, and many of those community offerings are ones that government invests heavily in. The legislation for this program is provided through the Support for Persons with Disabilities Act and the Social Assistance Act, depending on the scenario. There are regulations that follow for both acts and many policies that flow from that legislative framework. So the review provides us with both short-term and long-term recommendations, and the stage that we're at today is we're currently working through finalizing our implementation planning, ensuring that we have the right resources, the right level of readiness, both internally and externally in the community, and we've already begun work on many of the items that are included in the recommendations. So lastly, before we move into the presentation, I just want to say that we are incredibly proud of the work that's been completed to date. We're proud of the review. We're proud of the effort made by our project manager, Jessica Walker, by departmental staff who contributed all the way through, by community partners who were engaged start to finish and will continue to be engaged. Really pleased with the consultants' work. We're excited for the opportunities that the implementation of the recommendations bring. We're certainly proud of our staff and their dedication to supporting clients and the difficult work that they do every day. And we feel really optimistic for our clients, their caregivers, their families, who will benefit from the progressive, thoughtful recommendations that are contained in the review recommendations. So our presentation today, we're going to spend a bit of time on an overview of the program. We'll review the inputs into the review itself, including the scope of work, the work streams, the engagement, some of the themes. We'll talk about the recommendations for the AAS program. We'll then move into the residential services overview. We'll talk about recommendations from that program. And we'll wrap it up with expected outcomes and sort of next steps. So to sort of bring us to a common place of understanding, the Disability Services Program, the DSP, is the program that was replaced with AA, that AAS took the place of, sorry. So the Accessibility Supports Program was introduced in 2018. And at that time, the criteria was expanded to include both mental health diagnoses and medical diagnoses. And the eligibility criteria for this program is a person with a disability means that a person has a substantial physical, intellectual, sensory, neurological, or mental impairment that is continuous or recurrent, that's expected to last at least 1 year, and has a direct and cumulative effect on and results in a substantial restriction to the person's ability to function at home, work, or in community. So in essence, some of their criteria, one of a diagnosed disability, expectation that the impact of that disability will last for 1 year or more, and really what the assessment is looking at is the impact of the person's disabilities on their activities of daily living, their ADLs, and their instrumental activities of daily living, their IADLs. And so we get a lot of questions about the process. So what does the process of coming on to the Accessibility Supports Program look like? So we thought we'd take a bit of time and just walk through that. So in its most basic form, there's an application that comes forward, and this would include the submission of a health report that's completed by an approved medical practitioner. So it could be a doctor, could be a nurse practitioner, could be a certain type of doctor, a specialist doctor, and other documentation. So there could be historical information. Maybe somebody doesn't currently have a doctor, but they have historical information on their condition that is used to support an application. There's a clinical review that's undertaken by the clinical assessment team that are made up of social workers, registered nurses, and occupational therapists. And they are looking to confirm the mandated eligibility requirements that are found in the legislation. If someone has been determined to meet the eligibility requirements, then they would participate in a clinical assessment. And the clinical assessment is the standardized assessment tool called the INTERI, and you may be familiar with this tool. It's used by Health PEI, used a lot with home care, for example, and it looks at a standardized set of questions that are again designed to understand the impact of the person's disability on their activities of daily living and instrumental activities of daily living. And the outcome of that process is that someone is determined to have a funded ceiling level. So there are 11 levels of support within the Accessibility Supports Program. So then the next part, once that assessment has been completed and the funding level has been assigned, then they get attached to a support coordinator. And the support coordinator is really their person who helps them to navigate the program, to understand what they are eligible for assistance with, helps them to do their support planning. And so we often talk about the funded ceiling levels and the categories of support that are available in the Accessibility Supports Program, and there are 5. And so the first thing that I want to do is help you to separate the financial piece of the Accessibility Supports Program out. And so we're going to take that piece and we're going to set it over here, and we're going to agree that it's called the assured income component. So that's the financial assistance component. It's only available to people who are 18 plus, but we do have children who are attached to the program. Okay, so the assured income component sits over here, and it's really intended to help meet people's basic needs. So we'd be looking at, you know, the equivalent of the basic unit rate for all adults would be that $537 amount. And so for those of you that were at committee last time around, we talked about that. They'd also be eligible for assistance with shelter using our established shelter rates. They'd also be eligible for communication and for a community living expense. And so that's the assured income part. And then there's the very specific accessibility supports, disability specific funding that's awarded through those 0 to 11 funded ceiling levels. So someone could be receiving as much as $4,000 a month in their disability specific supports. And that money is used to address and help to support their personal needs, their housing needs, their caregiver needs, and their community needs. And the support coordinator's role is to really help the client to understand how and where they need assistance and support and help them to navigate that process. They have an annual review where once a year we review what those needs look like and make adjustments to that plan. If anything changes with the person's situation throughout the year, they can always reach out to their support coordinator and make any changes that they wish to their support plan. So then we'll look at the actual review and what we considered before we engaged in the review. So we started out with a mandate for our minister back in 2023 that directed the minister to undertake a review of the Accessibility Support Program to ensure that, or to determine if it was supporting Islanders living with disabilities to access the supports that they need to reach their full potential. So that was our starting place. And as we started to scope out what that review might look like, it became really clear to us that we needed to include residential services in that review. And so as you'll hear later, residential services is the component that makes up the day programming services and the supported housing options that are offered by our community partners. And so we knew that we couldn't, sort of make fundamental changes to the program without looking at those residential services at the same time. So we expanded the scope to include both programs, but we asked the consultant to deliver 2 independent reports, to deliver 2 sets of recommendations, but to carry out those reviews at the same time. Same stakeholder group, and wanted to, sort of make the most of the opportunity that we had to engage with the people who really need this program most and who contribute to the service offerings of the program, our community partners. So we put out an RFP, and in March of 2024, we awarded that RFP to Davis Peer Consulting. The deliverables were 2 independent reports that were released on June 1st, and they outline both short-term and long-term recommendations. So at short-term, we're looking at 1 to 3 years, and we would argue we're already into year 1, and we have many things that are already underway. And then long-term recommendations, which are looking at that 3 to 5 year time frame. And so our current status is the reports were released on June 1st, and we're well engaged in the implementation planning process. So when we were getting ready to put this RFP out, the better you define your scope of work in your RFP, the better product you're going to get at the end of the day, right? And we certainly, we receive a lot of feedback from our clients, from their caregivers, from our community partners, from our own staff. And we felt like, we've got a pretty good and solid understanding of where our problem areas lie, but we also had the distinct advantage of already having a very engaged community partner sector table that we sit at and meet with on a regular basis, and they really helped to inform what these review work streams would be. So very specifically, we asked the consultant to collect information, both through stakeholder engagement that Jessica's going to share information about, but also through looking at best practices that are carried out, jurisdictional scan information across the country, to really help us to, kind of look at the program that we have, which, by the way, is the envy of many jurisdictions. The program that we have, although it's complicated and it can be challenging, it is also very progressive in terms of those individualized supports that we offer to our clients. So we looked under the accessibility support review, we looked at the application and eligibility process, we looked at clinical assessment and reassessment processes, and we looked at the current AAS funding structure and category structure. We really wanted to better understand the client experience. And then on the residential services side, those community partners that provide these services are absolutely critical to us. We need them, they need us. We know that we need to make changes to our funding model. It was sort of, I think it was very probably deliberate and focused at the time, but it's sort of growing organically based on need and based on pressures. And we need to really sort out and make sure that the right supports are in the right places at the right times, and that it's, predictable, that it's transparent, and that it's sustainable. We also know from working alongside our community partners that supporting sector stability and sustainability is critical for their success and ours, and for the benefit of our clients. And that, we have a mutual and common goal there. We know that we need to have a look at wait list for services, so the needs are growing. Do the organizations that we rely on to deliver the services have the capacity to continue to deliver those services into the future? Do they have the ability to expand, to deliver services in a different way? So we knew that having a look at wait lists for services would be critical to the review. Currently, each organization operates independently and manages its own wait list. So there is no sort of coordinated process for how someone gets into day programming or into a supported housing option. So at any given time, we may know that, from information that our organizations provide us, there's about 200 people on the wait list, but we don't know if 50 of those people are on multiple wait lists, or if they're all individual, unique folks, or if people are on a wait list that they're actually ready for a service should it become available, or are they, planning for what future needs might look like. So we know that that's a really important part of building that sustainability into a system that's so badly needed. Inspections and monitoring. Currently, there is no legislative framework or sort of oversight on the services that are delivered by community partners. The day programming, the supported housing piece, there is no licensing, there's no monitoring, there's no inspections. So we know that's a gap. It's an area of concern, and it's one that we feel there's really good interest from our community partners in coming up and working together on a co-developed set of service standards, so that we can all be assured that the services that are being delivered are of a high quality, with trained staff who really know how to meet the individual and specific needs of the clients, and that there can be some transparent oversight to that. And finally, we looked at associate families. So if you're familiar with associate families, forgive me for a moment, think about foster parents and this important service that foster parents play in the lives of children. Associate families are a very similar model. So it's, you know, a loving, supported, appropriate home for an adult with an intellectual disability who may not have, either may not have family that are able to provide that care for them, or they don't have family. And it provides an opportunity for someone to live in a family-like environment and be as fully independent and immersed in community as they can be. And we think this is an area that, with the right investments and the right support for, can become a real option within a continuum of services. And we think that's incredibly important to move forward on. So I'm going to pass it over to Jessica, who's going to take us through the community engagement.
Thanks, Shelley. So, as Shelley mentioned, the community engagement portion of this was very, very important to us. It is a complex system, it's complex works, and the people that we're serving have a variety of needs, and we really wanted to make sure that we captured all those and that the client voice was really central to the work that we were doing and informing all of the recommendations. So we had a fairly extensive community engagement process. We held many sessions with NGO partners, so some of those would be our residential service providers. They're listed there, you know, Queens County Residential Services, Inclusions East, those types of organizations, and some were more broader disability support organizations like Resource Abilities and Spinal Cord Injury Association. We also held several sessions with our frontline staff and management. They are hearing about the pressures of the day-to-day. They hear challenges from clients and their families, and had valuable information to contribute to where we could identify some gaps and areas for opportunities in the services that we're providing for accessibility supports and residential services. We went right into the kitchens of the associate families to talk to the clients and talk to the associate family hosts about what the structure of the program currently looks like and what it could look like in the future, with some added supports, with some added structure and policy. And so had some really valuable in-person sessions with them. And we also made sure that we were connecting, as Shelley said, many of our clients are shared among multiple departments. And so we really wanted to make sure that we were touching base with our colleagues in education, in health, in mental health, with colleagues at the Office of Child and Youth Advocate as well. And so that everyone was aware of the gaps that we were being identified, and that we were working with them if they had feedback for us on areas where we could improve our communication and collaboration to make sure that we're closing up those gaps and really addressing the key challenges that people are bringing to the forefront. So we made sure that we were sharing the information that we found with those departments and also listening to them for their own feedback on the processes. And then my favorite part of this was the engagements in the community, and we were so happy with the turnout and with how these went. And so working directly with our clients and their caregivers and families for sessions across the province. And we also provided online options, so 2 online options, 1 French online option, and a survey portion as well. And so we had 270 responses to the survey. But we're very cognizant that there's barriers for these clients to be able to access these supports, and there's barriers for them to physically attend for some clients. There's other non-visible barriers for them to maybe participate in a group-like setting. So we made sure that if anyone wanted to express their opinions or share information with us, we were extremely accommodating of what that could look like for them. So we received some written submissions. We sat and talked person to person in office. I had individual meetings with folks. We did Teams calls with small groups of folks to make sure that we really could leave no stone unturned during the community engagement process. So I was really happy with that work, and we got some really valuable information from that. And I do have to highlight too, the structure of those community engagement sessions was quite intentional to make sure that people felt supported, to have their voice heard, that it wasn't a town hall style where you might not be heard. It was small tabletop conversations where they could kind of establish comfort with a group of 5 or 6 other families. We worked through different topics with them to make sure that we were, as Shelley said, defining that scope so that we got to the bottom of the root of the information that we were looking for. And so during those sessions, very happy with our metrics there. We had 91% of participants shared that they had a good time at the session, 94% felt heard by participating in those sessions, and 95% of participants felt that they were able to talk about things that really mattered to them. So this was the heart of our work here, and very proud of those metrics. We had very high survey response too, so really proud of that work, and thankful for our NGO partners too, who were critical in ensuring that we brought out the clients to those sessions and encouraging them to participate and hosting the sessions themselves. And so was a big driver in us getting this lovely and accurate information for us to be able to inform our recommendations on. So we'll talk a little bit about what we heard from the engagements. And so we regrouped some kind of key themes here, and there is what we heard document that is publicly available as well, but just to highlight some of the key themes that were hit. One of the things we heard is that there might be program options for them, but their awareness of them, their understanding of them was a big gap. And so while we could say, oh, no problem, we could do that, but if they don't know about it, it's not really helpful or supportive to them. So we often heard, I heard this from another parent, I heard this from somewhere else, and so we certainly saw that as an area of opportunity for our programs. In relation to the eligibility process, as Shelley explained earlier, it really is a step-by-step process. It's very thorough and rigorous, and for good reason. It's a substantial program that really we do need to ensure that we're meeting our Act-mandated eligibility criteria, but we can do a better job about communicating about what that process looks like, where in process people are, the information that we need, and we did hear that feedback as well. The timelines on that too were something that we can certainly improve and have improved since we got this feedback. Additionally, around funding and programs, really similar theme there on the fact that kind of the groups of pots of funding that we talk about, the 5 different types of supports still resonated with everyone, but they couldn't always articulate exactly what they weren't always aware or could really understand how to utilize that funding best or what options might work for them. They've also identified that there's a lack of flexibility in some of the areas, and that trying to fit themselves into buckets instead of us trying to work around their support needs was a point of frustration for many of the families that we supported through those community engagement sessions. And regarding residential services options, the key themes there were around, as Shelley identified, we don't have that formal monitoring and safeguards in place. So wanting to ensure that we do have those, they can feel confident in the quality and consistency of services under the residential services options. And another big highlight was transitions too. So transitions both when an adult with developmental disability or autism spectrum disorder is transitioning out of the school into community, but also for those who are transitioning later, if they've been living with parents, their parents are aging, and now they're considering moving to a residential option, and wanting more support around navigating that, understanding what the options are, and that was some feedback that we heard on the residential service side. We have fantastic providers on the residential service side, and they're really great at supporting our families, and we certainly have a role in communicating about that as well. So now the fun part, the recommendations. Today we're going to share a little bit about some of the prioritized short-term initiatives, and we really are trying to balance moving forward with some early positive steps and real solid actions in the first few years, but also understanding that some of our longer-term objectives are going to be broader systems and structure-based approaches that really will help us ensure that we have equity and sustainability in the system going forward. So nodding today at some of those early actions to highlight those, and one that we heard from our caregivers is the need to increase that caregiver support cap. And so we're using the language caregiver now. A lot of your constituents might be talking about respite and respite cap, but we're trying to broaden that language. Respite isn't always a supportive term, and to acknowledge that caregiving is broad, and what supports one caregiver might not support another. Every individual's needs is different. Every family's needs are different. So what we're doing there is trying to move up our caregiver cap to reflect the increase in the consumer price index since 2018 when it was originally set. And then additionally, we're broadening some of the definitions in our policy and making sure that we can add some more flexibility for different types of caregiver supports that might benefit the family overall. and really trying to acknowledge through that we are wanting to acknowledge that really the families are best placed to determine what helps in their lives. So our policies need to reflect that. The next one is on choice and empowerment. So, key to the themes that I highlighted that were brought up by the staff during the engagements. A central direction is to give clients and families greater control over their supports. They are best positioned, as I just said, to make decisions around that. And so wanting to broaden that out through a self-directed funding category. So this funding category, as they acknowledged, feeling like they needed to fit things in a certain bucket or in a certain criteria, will allow additional flexibility within that funded ceiling that they already have to be able to adapt that with less administrative burden to meet some specific needs. And we're also working to improve our communication about the available supports and client-directed decision-making. This improved communication is key to supporting their informed choice about how they allocate their resources and supports. For accessibility supports, kind of the final one that I'll highlight today is something else that we're quite excited about, and it's broadening the access to accessibility support services. So as Shelley highlighted, our eligibility criteria is substantive, but we are seeing Islanders come forward to say, hey, I am an Islander with a disability. I have some unmet needs. I don't qualify for this program. Where else might I go? And right now we don't have a service to offer to support them. I know that our frontline staff absolutely do their best when that situation comes up, but we don't have a formal navigation planning support for unfunded supports in place, and so that's something that we'd like to move forward with. So this new service will support navigation, referral, and planning only for any Islander who self-identifies as having a disability. And so we think this will really help us to support those, and it's also going to help us to understand who's coming forward, where there might be gaps in the system if we're finding that we have a lot of folks coming forward with a certain diagnosis and we aren't able to connect them to supports in other departments or in our own department or in our community. We fund a lot of community partners to provide supports as well, so making sure that we're referring that way. But this is going to also give us a really great data to inform metrics on where we need to allocate resources in the future too, and make sure that we are responsive to the needs and are observing the trends and making informed decisions about how we allocate our resources in the department. So the plan is to have 2 of these advisors, one in the east and one in the west, to be available to provide that support. As Shelley mentioned, the residential services review was a really important component of this. It was really important that we included this. All of the residential services clients are clients of accessibility supports, and then they kind of have this next layer of support with the being connected to our residential services community providers. And so this is serving our adults who are 18 and older with intellectual disability or autism. It's with our partner organizations like Trempeloy, like Community Connections, and it delivers a variety of service. So there's more than, I think we're well above $19 million in funding for these community partners now. That was our numbers that our review was based off of in 2024, 2025. So these types of supports would include group homes, small option homes, independent living, associate families, day programming, employment, and skill development. And as that's a long list, the name residential services doesn't really reflect the broad services that we are offering. And so we kept residential services because that's how we did the review. We're keeping it in this briefing today, but going forward, we will be shifting that language to community living supports. And so we find that more inclusive language and really more reflective of the services that are optioned. Not all of our providers actually offer overnight residential services, but they do offer really valuable day programming, skill development, and employment supports too. So that will be another change that's connected to this. And what we wanted to highlight with just an overview of residential services is that we do see continued growth in this population, and we can hear anecdotally from our colleagues in education that the support needs continue to increase and continue to, the demand for these services we anticipate will continue to increase. So it was important for us to take a deep dive on this and ensure that we're setting up our system and our supports and our sector to be able to prepare for the continued projected growth over time. So we're currently serving just under 600 clients through this stream. Many of them access, nearly 500 access day programming support, and most of them are accessing services with some of those core funded partners that I've indicated, who have kind of nonprofit boards and are governed and have longstanding relationship with government. But we are seeing an influx in private providers popping up as well, so that offering day programming, offering different types of services. And so we're seeing a lot of families choose to go with those private providers, which they're absolutely able to do. It's their funding, they choose how to allocate it. But one of the challenges that Shelley identified too is that we don't have quality service metrics in place. We don't have safeguards in place. So a family may choose to access day programming. We may have a higher level of confidence in a provider that we've worked with for a long time that's governed by a nonprofit board, but some of these for-profit or newer businesses, we want to make sure that we have an opportunity to have some quality service standards in place going forward for that too. These can be vulnerable adults. They can sometimes be nonverbal, so if there are things that are happening, we want to make sure that we have the safeguards in place that they might not always be able to express if there are concerns with programming. So through our files, because many of the accessibility supports clients are directing kind of their funding towards these providers in addition to the funding that we provide. So there's an additional about $9 million that's coming from our clients' individual choice allocated to these as well. So it'll be around $30 million in supports that's going out to support this residential services sector right now. So this is the same as accessibility supports. We're prioritizing some short-term, actionable, impactful recommendations, and also, particularly with this one, really investing in some long-term approaches to enhancing our system and setting up equitable funding models and all those things going forward. So the first one, it will be no surprise to anyone that we are recommending that we move forward with quality service monitoring. And so quality service monitoring, that we co-develop these standards with the sector. We work very closely with them. We've already had lots of great discussions with them about this. They're very on board with establishing standards. Many of them would be exceeding the standards at the current time. And so they're quite engaged with us on this process. And then we would like to move to a formal licensing and inspection system with a health and safety focus for group homes and small option homes with 4+ residents. And that's quite consistent across jurisdictions, that there's a bit of a threshold once the home meets a certain size with a certain number of residents, that this health and safety layer is put in place to make sure that there's an added layer of safeguards. So our department would retain kind of quality service oversight, but we may see that formal licensing and inspection system is best placed in another department. Another prioritized short-term initiative is the sector support. So such a critical sector, supporting many of our vulnerable adults in community and doing some really great work, and we want to make sure that we're investing in this sector and supporting them to have the resources that they need to do to provide high quality service. So 3 of the ways that we'll be doing that are enhancing our training and development, ensuring that we're working with them on wage considerations, and knowing that there's significant pressure for this sector in wages right now. There's lots of kind of adjacent professions. Early childhood educators would be one of them that would kind of target a similar kind of pocket of folks with human services backgrounds or different educational backgrounds, and certainly that's an attractive role for the same group that our NGO partners are targeting, and it can be a real challenge for them to recruit and retain staff. And additionally, we are very happy that we are supporting some centralized supports, and so a new umbrella organization, Essential Disabilities Services Alliance, is now kind of representing the interests of the broader sector and able to kind of build together some centralized resources. We were already able to allocate some funding to this organization to develop some training that will be able to be utilized across all. There's 500+ staff that are supporting the sector from tip to tip. And associate families, so it is.
Sure. Carla?
Thank you. Sorry to interrupt. I just want to ask a clarification question. The Essential Disability Services Alliance, what is that? What is that?
So it's a new umbrella-type organization that's made up of existing service providers. So Queens County Residential Services, Tremploy, Surrey Group, Surrey Harborview Training Center, Community Inclusions East are all representatives and members of EDSA. So the main core organizations remain the same, but this is more like an industry association or a sector council where they'll work together on issues of common interest. So the very first big thing that they've done is, besides forming an organization, is that they have worked to develop an online learning platform and created specific learning modules for employees of all organizations. So they looked at what do we feel we need for like core foundational training? What's a must-have? And they went ahead and created 3 or
3 right now and
Yeah.
a few more in the hopper.
and so all the employees of those individual organizations get a unique username, password, and they can log on and do their learning and certification. And so when you think about some of the geographic challenges that some of our organizations would have in recruiting and retaining staff and matching some of those wages, and participation in training opportunities. The Surrey Group Home has 6 residents. We have a very small staff. To have specific training just for them, it's difficult, it's expensive, so this was a way, they're coming to us individually and lobbying for different things, and we said, there'd probably be a lot of value in you folks coordinating your services. No one wants to give up their individual organization, and we're certainly not looking for that, but is there a way that we can talk to you as a consolidated group and talk about ways that government can invest and really help to address real issues that you're facing? And so we started this formal partnership. We meet on a very regular basis. We provided some initial funding. We helped, through Jessica's help, we helped them to leverage some funding through the National Action Plan to End Gender-Based Violence to help with the creation of these modules. And so far, so good. We think it has a lot of potential, and when we think about some of the long-term recommendations included in the review, we're wondering where this organization can help with the delivery of some of these things, right? Yeah.
That was great. That was a great question.
I should highlight on the sector support too, one of our longer term objectives we're highlighting short term today is a clear and predictable funding model, which is really going to go a long way in the long term for those kind of wage considerations, understanding what they have available to them for staffing, longer term planning, and that'll play a big factor in this as well. And it's a longer term objective because we do need to work really closely with them to make sure that we get that just perfect. So we need some extra time to do that. So for associate families, this, as Shelley said, is really an opportunity. Associate families is it's a widely used service across the country, and it's probably underutilized in Prince Edward Island in that we probably haven't turned our attention to it in recent years, and so haven't been actively kind of working on the development of policies and supports and processes as a government to kind of continue to encourage folks to be interested in this and publicly share the funding that's the compensation for hosts, and all of those pieces is what we'd like to move forward with, enhancing the structure, building a really solid base, clarifying the governance so that we can be really proud of the associate families program that we have, and then we'd like to go out and make sure that we're communicating about that and recruiting new. The associate families can be such a great match for professionals that have a little extra time, that have a basement suite. In other provinces, they may be mental health professionals that have the capacity to do support for someone that has some independent living skills, and they benefit from financial compensation, but also from the engagement of supporting someone in their home when they do have the space. And so it's a great service option, but it does need some attention, some support and tools. And we do also recommend, the funding has been a little case-by-case basis, kind of historic, piecemealed funding, and as we are recommending a consistent and clear public-facing funding structure for this support type, and enhanced training and professional development for those associate families hosts as well. Some clear and consistent program going forward. All right, and I'm going to pass it along to Anne.
The easy job of just closing things out and reiterating some of the highlights of the presentation. If you wouldn't mind hitting the final slide. On the expected outcomes, as Shelley and Jessica highlighted, the advancement of both the Accessibility Support Program and Residential Services Program reviews will positively impact thousands of islanders living with disabilities, their families, and caregivers. Impacts from the Accessibility Supports recommendations will include increased autonomy through family and self-directed funding, reduced financial pressures through updates to client contributions, more support for caregivers as referenced through the respite cap increases, expanded services through the implementation of the planning-only support role, excuse me, it's warm in here. Impacts from the residential services recommendations, as Jessica just highlighted, will include access to high-quality programs provided by well-supported NGO partners, strengthen safeguards in a healthy residential services sector, enhance support options and future planning through enhancing the associate family structure, transition supports, waitlist processes, planning registry, and a new capital infrastructure funding process. So the review clearly sets direction toward a more person-centered, flexible, and sustainable system of supports for people living with disabilities and their families. Our implementation that has been highlighted throughout the slides is underway. We're still planning some of the larger components, which includes internal operational work with staff, developing legislative work plans, budget considerations, strengthening communication tools to better support clients, families, and community partners. So in looking at both the short-term and longer-term priority planning, some of that work is well underway, as been referenced with some of the policy updates, the planning for communication tools, working with our sector of community partners to develop some of the longer-term monitoring and planning frameworks to support the individuals that we all serve, with a real focus on collaborative support planning with all of our other internal government departments as well, so that we can ensure that it is person-centered.
And that brings us to the end of our presentation, although we may have just lost the... Anyhow, there we go. We're confident that's our last slide. There we go.
It is.
There we go.
It is.
There we go. For you and us both.
Okay, so we'll open the floor for questions, and first I have on the list is Brendan, and then I'm going to go to Carla, and then I'm going to go to Carolyn.
Thank you, Chair, and thank you all for coming in. I know there's a lot of work that goes into some of these presentations for Standing Committee, and it piles on top of the great work that you're doing in the department for some of our most vulnerable islanders. But my questions are going to be more surrounding some of the caregiving supports or supports to caregivers. In your slide, you mentioned kind of expansion on respite or caregiving grants. Besides the increase in the cap, can you explain any other steps you're taking to expand these caregiving grants? And I'll get to where I'm going after.
Yeah. Sure. So some policy changes are allowing for some of your caregiver funding to be utilized towards caregiver education. So we did hear throughout the review that someone may be supporting someone who has disability that there's not a lot of information on, or that they could benefit from getting more education on to help them understand how to better support the loved one. And so we are now allowing that to be fundable through caregiver supports and transportation to that education if it is required, if that's a barrier as well. So those will be both newly available under our caregiver policy. And it also really clarifies the definitions of who can be considered for caregiver and respite funding. So we often get questions about can a sibling, if they live in the home, if they don't live in the home, like what are kind of the, logistics of who can and who can't, and the rules are. And so we realized that it wasn't quite, we often accommodated the requests that were coming forward, but it should be clear in public facing policy. So making some adjustments so it's very clear what is all of the options that are available to those caregivers and those families to decide how to best use their respite funding. We do often hear that it can be challenging to find respite providers, and so making sure that we expand those definitions and are allowing for flexibility because it is really required.
The fit is so very important.
Yeah.
As well, right?
Absolutely.
So the person with the disability and their families really need to be comfortable with the choice of who is giving that caregiving support. So we recognize that.
Brendan?
Thank you, Chair. So you expanded the definition of who could be a caregiver. Was there any consideration put to looking at the definition of the person requiring the care? And where I'm getting to is the at-home caregiving grant. That is, I know it's a health program, but it's administered through your department. And there's one kind of sticking issue that a number of constituents of mine have brought, and it's that responsibility or that requirement that there is, how's it put, as having a high likelihood of admission to long-term care in this program. Now, there's a number of people, there's one specifically that comes to mind that it's not necessarily that the individual person's over the age of 65, but there's really no need for this individual to, it wouldn't be actually assessed as required to go into long-term care, but really requires 100 or 24-hour-a-day support. They've been turned away at different programs because the issue with this constituent isn't necessarily a physical disability as sorts, and isn't also required long-term care, but has an issue that requires that needs 24-hour care and can't go to work. So, is there any consideration being put to kind of looking at those two programs, perhaps opening up the criteria for some of these programs? I understand there has to be some sort of I wouldn't say floor or ceiling, but there has to be some sort of threshold that you have to meet. Is there any consideration being put to perhaps lowering that threshold for people like the constituent for which I'm talking about?
So with respect to the Accessibility Supports Program, there is one of the fundamental requirements, eligibility criteria, is like a confirmed diagnosis of a disability that falls within those 5 categories that we mentioned, right? So that's key to the eligibility criteria. So this review did not make any recommendations, nor were we seeking any recommendations on that particular front. And the legislation is pretty clear about what the program criteria need to be. With respect to the at-home caregiver benefit, we are the administrators of the program, and what I will say is that we have we have a number of clients who are in receipt of both accessibility supports, the at-home caregiver benefit, and other programs across government, and including home care. So there isn't any restriction between accessing multiple programs. This is the opposite of what your client constituent is facing. I recognize that. But if there's a financial need, certainly they may be eligible for some of that basic need support, but on the supervision and oversight, I'm not aware of any support that may be available. It certainly sounds like a very challenging situation.
Brendan, do you have another question? I can come back to you. Okay, Carla.
Thank you, Chair, and, excuse me, thank you for your presentation, and I've been waiting for a long time for this presentation. My first question, I'm looking at the expected outcomes, Anne, that you mentioned, and the increased autonomy through family and self-directed funding. I just did a quick spin through the review document. Is that the $200 that you speak of? And if so, is that $200, can you do anything? Like if massage therapy is not covered under accessibility supports, does that mean that $200 self-directed funding, I can go get massage therapy, I could pay for a counseling session for, am I allowed to do whatever I want with it, or does it still fall in a box?
Yeah, it falls in a box, but the box isn't taped up fully on all the corners, and it's a box that we folded the flaps over on, because it still has to be something that is covered within the parameters of the program. So when we look at things that aren't covered in the program, we're looking very specifically at what is identified in the regulations for the supports for persons with disabilities, general regulations, and there's a very specific number, 5 items that are not funded. And so what the increased flexibility allows for is for, one, that people don't have to have the expense approved in advance and they don't have to submit their receipts to receive reimbursement. And it allows for things that we would more commonly have been traditionally referring to as social inclusion. So if you want to go to the movies, you've got a little bit of flexibility in your budget to make those decisions. You want to go for a coffee date. You want to, you want additional one-to-one support, or freedom and flexibility within your funded ceiling level, but it's still, the expenses still have to be related to things that are fundable within the program.
Carla?
Thank you, Chair. And I know people liked the box analogy, but I didn't love it because it sounds like it may lead to inconsistency. And when I'm looking at the review work streams and what was within the scope of the review, I'm not seeing anything here about the review of services offered to see if they are effective, to see if it's enough, to see, because one of my issues with accessibility supports all along has been, especially as it pertains to children, but now I'm learning as adults too, but I think about, we'll cover equine, like an equine program where they work with horses. It's not counseling, but it's something to help with the behaviors rather than getting to the root of the behavior. And that is my issue with this program. So was there any, in this scope of review, did you look at services offered?
Yeah, certainly, again, one of the fundamental tenets of the program from its inception was that it was not intended to duplicate other services and supports that are offered either by government or invested in by government to community. And so we have on different occasions, some related to the review, some, based on very specific client inquiries, and some when it just feels like, there's a number of commonalities bubbling up, that we've reached out and sat with mental health and said, through the community mental health program, what kinds of therapy and counseling can be accessed and where can it be accessed? Because we need to get this information to our clients, because they're asking us for things and we understand there are real needs being presented by these families, but they are very clearly things that we cannot fund. And it does get back to, we've got regulations that say we can't fund it, but that doesn't help the person who has the need. And so we're really wanting to focus on helping people to understand what supports and services can be out there, and to have enough regular communication and contact with other providers to talk about what we're hearing and what we're seeing and where the needs are. And, the recommendations point to the very need for that collaboration and information sharing across government to ensure that multiple departments that have, opportunity to provide really important services and gaps that are being seen have an opportunity to provide them and fill in the gaps. Do people get creative with how they access services that they absolutely need? Yes, they do. Therapy and counseling are, areas that we're unable to fund, but we certainly recognize they are needed supports.
Carla?
Thank you, Chair. Do I get one more question?
Yes, you do.
Okay. I have a clarification question in there, but I'm just going to leave
No,
it.
you
'cause
go ahead and clarify.
Is that okay?
I got given the luxury yesterday, so I will pay it forward.
Thank you. And so the services that clients may want to access but are unable to under this program, that will be the navigator's role to help clients identify what other services may be out there for them.
The support coordinators certainly try to do that as it is right now. And do they have all the information all the time? No, probably not. Is it always evolving? Are services growing and expanding? Yes. Are we aware of the fact that we need to ensure that our support staff have the most up-to-date and accurate information? Yes, we are. Is it a priority? Yes, it is. But if you are a program client, if you are attached to the program, you have a dedicated support coordinator, and it is our expectation that that support coordinator helps a client to navigate to access needed supports. So that can be sharing information, that can be helping to make a warm transfer, a warm handoff to another government department or agency or community organization. What we're talking about for this new support planning navigation advisor role is that in the past, when people have come and applied and they've gone through the process and it's been determined that they don't meet the eligibility criteria, that's sort of the end of the discussion, right? So, you've applied. In some cases, people have a documented diagnosis of a disability and, but they don't meet the substantive impairment criteria for the program, and we don't really have anything to offer them. But we're aware that there are a lot of services and supports that are out there, and people are falling through the cracks, and people, could be getting a much more, collaborative, warm transfer and support to access services if we could fill that gap, and that's our hope with these advisor roles.
Carla, do you want to
Thank you, Chair.
question?
Yeah, thank you, and I appreciate that. My next question is kind of on, because it's not, we kind of have the recommendations, but not specific things. So I'm going to ask about two specific things. So one of the things identified in the Seniors Independence Initiative is that asking for 3 months' worth of bank statements is an invasion of privacy. So will that 3 months of bank statements still be a requirement for this program? And how is it not seen as an invasion of privacy when it's seen as an invasion of privacy in another program within the same department?
Sure. Well, they're two very different programs. One of the programs is about meeting very basic needs, on the assured income side of the Accessibility Supports Program. And the Seniors Independence Program is a wonderful program that is definitely important. It is complementary to keeping people at home and in community, and that is, incredibly important. But the order of magnitude of the value of those programs, the Seniors Independence Initiative, it's $1,800 a year. The Accessibility Supports Program, we are talking between $25,000 and $40,000 per person per year on sort of an average file. Our budget for the Accessibility Supports Program is $61 million. We've got over 3,000 clients. The fiscal responsibilities, I think, that come along with that. And it's really about verifying a person's eligibility for the program and their need, establishing that need under the Accessibility Supports Program. I will say, there's a couple of other pieces, is that only adults access the assured income component. So for children's files, we don't look at a parent's income, right? We don't need to verify whether a family has a really high household income or a really low household income, right? For a child's file, when it's a child applicant and a child that's a participant in the program.
Can you put me back on the
I
list,
can
Chair?
put you back on.
Thank you.
Carolyn? As others have said, thank you so much for the presentation.
And devil's always in the detail, right? And so here we go. So I have, forewarned. So I have a situation, Brendan talked about a constituent that he's working to support. I have another family who are incredibly frustrated with this, and you talked about that, frustrations that families feel in the application process. And respect that you need to have the rigor that you need to have. In this particular family situation, the family believes, and the family is a grandmother and an adult child with a young man with high needs, would certainly qualify, nonverbal autism and so forth. The family's perspective is they've tried to apply and can't get anywhere, incredibly frustrated, so have given up. And so there's no way this family, from the outside looking in, doesn't qualify for some level of support. In particular, now that this young man is now an adult, right? So, but I don't know how to encourage this family to come back to say, you need to try again. They're that frustrated with the application process. We have family a young man that's losing out. Right.
So how do you help navigate that? What do you suggest? Who do I encourage this person to, beg this person to try and go again? But I guess, and you've heard that, the application process is incredibly frustrating to the point where people have just walked away. So how do we get at that? This situation, yes, give me a name, I'll give the name out. But how do you truly get at that?
Yeah, well, I think a few things that we have done is that we have the department utilizes a centralized screening unit. So we have screeners who take all the incoming calls for applications for service and for all of the programs. And one thing that we've been discovering is it's a lot of information. It's a lot to know. And it's difficult to manage, and be acutely aware of 5 or 6 different programs and all of their eligibility. And so what we have decided and already implemented is that for the Accessibility Supports Program, we need to have a dedicated accessibility support screener. So someone who gets up every day with their purpose in life is to provide supports to either applicants or clients of the Accessibility Supports Program. And we have found that that is already making a difference in terms of the timeliness of responses and follow-ups, because what happens sometimes is that a client comes forward and they're ready to apply, but they may not have all the necessary paperwork that they require. So it could be, that proof of the disability that they have. It could be that they have a pressing, imminent financial need today, and we know that this application and eligibility process takes some time, so they get attached to the social assistance program so that they can have their immediate financial needs met, and then there's follow-up. And because maybe they're having their immediate needs, financial needs met, the urgency to gather up that additional paperwork to support is less urgent. And perhaps that file sits for a while because, and then it comes time, something else in their situation changes, and then they say, oh, right, I was supposed to be on the disability program, not on the social assistance program. And so then, some time can have lapsed, right? So one thing that we've identified is that we need somebody whose purpose in life is to follow up and track down and, persistently, engage the client in completing the necessary steps. We have, for the first time, as of this week, in 3 years, have a fully staffed complement of accessibility clinical assessors, which is awfully exciting. And those are the social worker, OT, RN positions that we have, so there's 6 of them. That will help a lot with getting assessments done in a more timely manner. Our regulations lay out timeframes for reassessments. We have a very long backlog of reassessments that are waiting. So we've got new people coming in. We had more than 300 new clients of the Accessibility Supports Program in the past year. So we've got people coming in and we've got people that need to be assessed and reassessed. So there's a lot of pressures there. So we're looking at the processes and the flows internally, some of that administrative work. How can we better support people? And our manager of clinical services is probably the person that I would suggest that you have the client or his mom or family member reach out to. And she can help to support understanding what are the barriers that are preventing this person from being determined, or if they're not eligible, to at least explain in a clear and concise way why they're not eligible, and then what are the other supports that may be available to this individual. So the manager of the clinical assessment team is Lori Jones, and I can follow up with you on her contact information.
Thank you for that clarity. Thank you, Chair, sorry. Yes, this is a young man who's transitioned out of school and feels like perhaps been lost in that transition process
Yeah.
and is now an adult.
Right.
And who in need of care. So it's great to see that this is being tightened up for people. This is a family and not the only one who struggles, right?
Yep.
Okay, thank you. So under expected outcomes, we talked about reduced financial pressures through updates to client contributions. I understood that the program, explain that, because I understood that this was client-based, and so, and for children, you talked about
Yep.
that. And so, but what does for contributions mean?
So for adults, if they're in a household, we consider household income in all circumstances.
Okay,
So if I am a person with a disability and Ann is my spouse, when we apply, we're looking at our combined total household income, right? To determine eligibility for the accessibility supports for the assured income component. And then there's a contribution schedule. So
Okay.
you may receive some partial support, but you may have a client contribution that has to be made. And one of the recommendations that we're so very proud is included in this review and that we're excited about moving forward on, and that we heard loud and clear from clients, from their spouses and partners, and from advocacy groups, is that we are discouraging people from entering into normal relationships. You know,
Right.
that we're keeping people from being able to enter into a intimate partner type relationship because we're penalizing them financially. So we're looking at like how can we make changes to that so that the disability specific supports, so that funded ceiling level, not the assured income, but the funded ceiling level, will no longer look at the spouse's income. And so there'll be, and Jessica's, I probably am out of my league here trying to answer this question, but the contribution schedule, the income thresholds that we use need to be updated. And so we'll update those to be current with MBM.
MBM.
So two really big, those, we feel really good about those recommendations. And we feel really hopeful for people. And so there's some work to do on that, like there's a update to our regs that has to be made to the schedules to accommodate that and some internal pieces, but definitely an important one.
Carolyn?
Thank you, Chair. I couldn't agree with you more around thresholds and people being able to enter into relationships and that not penalize them. And hopefully both those two approaches to this program will follow through in other programs that you have, at your disposal within your department that right now do penalize people. So if we've learned it in one, let's transfer that to another, right? And childcare subsidy being one historically, that's been an issue. So that's a statement. I'll go on to my question. The workforce area and the resident, excuse me, I'm talking about the day programs, residential programs, but I'm going to specifically look at residential programs. So I understand the complexity of hiring staff. It's 24-hour service in many instances, group homes and so forth. But is there a requirement to always maintain trained staff in the residential homes, in group homes and such? And are we meeting that threshold when you talk about the pull? And I know that's across sectors. It's not unique to this one. But what does that really look like then for individuals who may need continual care 24/7 if we're not able to meet that workforce demand? And I'm concerned that while I appreciate the professional development component that the Alliance has done, that's not the educational training, that's professional development. There is a difference. And so where do we sit with that? And are you concerned about that?
I think we're always concerned that there, that there's enough staff and that they are appropriately trained. And, certainly if it hasn't been said here today, certainly one of the factors that's sort of driving the challenge here is the complexity of clients and their
Right.
needs, right? And the making sure you have the right staff that are adequately trained and capable of providing those supports and keeping people safe, needs to be front of mind. I will say a few things. We've been working and having conversations with Skills PEI and engaging EDSA and Skills in conversations about how do we ensure there are more trained people ready for this service available, and what are some of those initiatives. We have the Accessibility Advisory Council. They've been doing some promotional work, having accessibility fairs and trying to, open up exposure. And what more can be done? Is it additional cohorts of the Human Services Program? But I certainly want to also add that our partners sit on the advisory board of, how Holland College has the advisory councils for each of their programs. And they have expressed and will continue to advocate for ensuring that there is specific alignment between the learning and training and what's needed by the sector, right? And ensuring that high quality, appropriate training is being delivered that meets the needs of this sector. And so, one of the things that has been discussed is, whether it's regionality or right here in Charlottetown, you have someone who has really good skills, really good foundational knowledge about working, maybe it's lived experience, a family member, working with people with disabilities, but they don't have a formal education. How do we bridge that gap, right? So these professional development modules are great, but some of those modules are very core and fundamental to being able to support the clientele. So how do we expand on that? And we feel really enthusiastic about this partnership with EDSA and the opportunity for the learning modules, because we feel that it will start to address some of those geographic pressures that some of the organizations are feeling.
Thank you. You put me back on, Chair.
I sure did.
Yeah. Thank you.
Hilton.
Thank you for all that you've been doing. It's great. You talked about the community engagement. What would be the biggest things? I know you've probably touched on one or two of them. But what's the biggest gaps that were identified in the community engagement?
Yeah, do you want to take that, Jessica?
Sure. I would say the general themes that I highlighted there of lack of awareness and understanding and systems navigation. So both of our programs, but also, the wider supports and a feeling like the families were left with the burden and the kind of the responsibility of trying to figure out where to go or what they could access and placing responsibility there. So you'll see a lot of our recommendations, and some of them have started already, are on enhancing our communication tools, web presence, building new planning support tools so that the families will have a little more to work with and be a little more confident that they're understanding the systems from our perspective. And also we are actively engaged in interdepartmental committees to further the work of collaboration and so enhancing our understanding of the other options that are available, but also kind of advocating that those are clearly public as well, because we did hear so clearly from families that it wasn't always clear what they could access and how to access it. So,
Can I add to that a quick response? I went to the engagement sessions as well, and I was I was a little bit taken back, actually, by some of the stories that were shared by clients and family members about their lack of understanding of what they could access benefits for. And, you know, I think, so when I say we're already addressing some of the recommendations, you know, probably the next morning, everyone was thrilled to see me coming to start to talk about, you know, making sure we know what we don't currently know and making sure that we're sharing it with others. And, you know, some of those tools that we intend to bring forward really do, you know, even the setup of the engagement sessions where, you know, they had placemats on the tables, and so people could leave their comments and write their comments, and it really, and you know, people were speaking and sharing ideas and talking in small groups, but there was so much sharing that was happening between the families that had come out. And sharing information about so-and-so that does this service and so-and-so that does this service and how you can get access to current unmet needs. It was very inspiring, but that placemat idea really left a mark on us that we said, you know, we have clients who come in and you've got someone sitting across the desk from them and they're telling them reams of things, like lots of things. And then, you know, they leave and they've got lots of paper. But we need to make sure that they understand what all the paper means. So focus on plain language, right? The use of plain language, and on visual and written materials. So, you know, we're planning a menu-style collaborative support plan where our clients can sit with their support coordinator, and those buckets that we always talk about, the categories, like really laying it out very clearly. These are the things that we can fund, and these are the things that can't be funded, and that people can choose the things that they want to have support with, right? And walking through the math with clients. So if you have $2,000 in funded supports, and there's 4 categories that you can choose between: caregiver, community, housing, and personal needs, how do you want to distribute that money? And making sure that we're taking the time to really explore options with the clients. And that's challenging, right? It's challenging for the clients. It's challenging for our staff, right? They've got big caseloads and they have to do a lot of administrative work. But, you know, I think we're all feeling really hopeful. And what we're very acutely aware of is that this review and its implementation, we need to sustain that enthusiasm and the pressure to see the recommendations through to implementation, right? Because that's where the difference will really be made, is if we implement. It's great to have a report. These are great. I have a whole bunch of them in my office, you know. But we need the ones where we can look through, and all these little notes that I've got for myself that I can go in and say, yep, we did that, and we did that, and we did that, and we're making a difference.
If I could just add something, when Shelley talked earlier about the screening of that initial application or touch point, and that we have one person that is dedicated to understanding some of the needs. You'll never understand all the needs, but generally understand some of the needs of the individuals calling. That signals a change. What is very important, we talk about caseload numbers, we talk about challenges in staffing, both within community and government, but what is important is when staff are working with a family and they're sitting with that family, that they're present with the family. And some of these tools will help facilitate that conversation. And so from the time the call comes, where we have that dedicated individual, right through all of our assessors, which we're now, as Shelley mentioned, filled, first time ever. It's a wonderful feeling. It's building on that momentum so that when it comes to the support coordinator, they're able to engage. Our staff do a great job of meeting people where they're at, providing financial supports, information, navigation, but it is very challenging if we don't provide them with the right tools. And so that's part of that implementation that's already ongoing. Hopefully, the reviews will continue to be the foundation for that shift.
Can I just ask a clarifying question on that? You don't mind, do you? If there's somebody who has maybe a literacy difficulty, is there somebody that can help them fill out that application?
Oh, absolutely. Yeah, I mean, and options for that are, you know, they can bring a support person, they can ask for our support, they can do it over the phone, they can do in person, you know, if we needed to do, depending on which stage of the application that we're talking about. Like a lot of people do the initial screening over the phone to collect the baseline information, and then an appointment gets set, and then they come in with documentation. But yeah, I mean, someone only needs to let us know that they require that support, and I mean, that extends, there's literacy, there's language, right? So translation services, like, as long as we know, we can appropriately plan to support people. And, you know, oftentimes we have clients who are coming to us with support from groups like Resource Abilities or the PI Association for Community Living, right? So, and we value their support in helping to make the experience better for clients.
Thank you. Hilton?
You just opened up another question. When you were in last and I asked about the twice a month budgeting, some people have a hard time.
Yeah.
Do we provide some services? Do we provide any kind of, or offer any budgeting services for clients? So, like I'm hearing them saying that, you know, they get once a month, they get a check and they have a hard time to make it through the whole month. So do we provide any of education for them as far as budgeting?
We don't directly provide that service,
Okay.
but we do, it is an eligible expense that if somebody wants to use their personal support to engage someone to help them with budgeting life skills, that's a really common piece that people use their accessibility support funding to access those services. And of course, there are organizations who would also help with some of those pieces. And one thing that I would be, I think, remiss if we don't mention is the PI Association for Community Living offers a really wonderful program called the Support Match, where they match clients and their needs with providers of services.
Okay.
And it's really great. It, you know, it sort of looks like the Big Brothers Big Sisters model, where, you know, you understand what the client needs are and you've got people that are willing to provide services, and you make the best possible match for the best possible outcome. For paid, like, these are paid services, but they have the ability to use their funded ceiling level to access those services.
Okay.
Hilton?
And I'm just touch on what Carolyn brought up there about the residential services, like the wage compensation. Education is one thing. Are we doing anything else? Because I'm sure it's nice to hear that we're filling positions. Are we doing anything else to try to help support the workers?
Yeah, and are
Other
you
than-
talking about like our community partners, workers, or our staff?
Your staff?
Well, for our staff.
Well, both, I guess.
Yeah, sure, okay, well, it does apply to both. I mean,
Yeah.
for our staff, they're unionized public servants that fall under the collective agreement, so, you know, the wage piece is considered in all of those things. On our community partners side, some of them do have unionized workplaces, some of them have formalized work agreements where the wages are known well in advance and set out, and some are a little less formal. And so one thing that we try to stay, you know, aware of is what those wage disparities are. And one of our ongoing conversations with organizations is about how we can address, you know, that, I don't want to say parity, but at least comparable and within an acceptable range, because we do see quite a range from organization to organization. And of course, many of these organizations rely on government for the vast majority of their funding, right? So it is part of why an updated funding model is required, to really understand what are the services that are being purchased, because that is in effect what is doing. There's a partnership, but we are purchasing services for our clients to be delivered to our clients. So ensuring that appropriate funding models exist for those organizations to be able to pay their staff an appropriate wage and to be able to, hire appropriate people to fill those positions. And so, training and support is an ongoing concern for us, as well as ensuring, like Ann says, that you can't expect people to do a particular job or have a particular outcome if you haven't given them proper resources. And one of the things we talked about the last time that we were here at Public Accounts, was around some of the constraints that we have around our technological systems, right? So this is an administratively burdensome program, and we are constantly looking for ways to make that less so. And at the same time, balance the fiscal responsibility that we have to administer the program.
Hilton, I can't remember whether you're on 1, 2, or 3.
I was on 3.
I feel like when we were in school, we used to give kids sticky notes to write down their thoughts so that they didn't interrupt people, and I have all these thoughts now. Next on my list is Carla, and then I have Carolyn, and we'll see from there.
Okay.
So Carla?
Thank you. I'm kind of going back to, I can't even remember exactly what we were talking about right now, but I was thinking about like cultural shifts within the service delivery. And so when I think about that, I think about, the spectrum of staff we have in meeting people's needs. Yes, you're going to have staff who meet clients where they are so well, and others who just don't. And then, the time it takes, and the importance, of course, to sit with clients, to make sure they understand, to ensure that, with their different abilities, that you're getting through to them, and that they're kind of eating what you're throwing at them, sort of thing, and that it is trauma informed. And so all of that takes time, right? It takes a longer time to sit with someone and do all of those things. So how do you lead that? I'm going to call it a cultural shift, understanding there's staff in there who are phenomenal, and they're doing that already. And then there's staff who need some work in there. So how do you lead that cultural shift, understanding it takes time, and time is money? And so how do you lead that shift?
Yeah, I think Ann and I maybe both want to answer a bit of
You
this
start.
question, but I'll start us off. Okay, so we have been doing very purposeful and dedicated work within social programs, very specifically an initiative called Enhancing Social Programs. And we've created working groups based on 5 themes that were identified by our staff as areas where they felt needed to be prioritized. And so they're everything from, training and development to leadership enhancement, and understanding what the leadership of the division is giving to them and what they can come to expect from the leadership. They want clear direction. They want clear policy to work from. They want accountability. All very reasonable things. We ask people to come to work every day and perform really important work, and when it feels to them like the sand is shifting beneath their feet, it's really difficult to be able to do that. And we've had a number of different people in senior leadership roles within the division in the past number of years. And so it's been really important for us to stabilize that and to be present and to really hear from our staff about what it is that they need to carry out their work. So what they need and what they've told us clearly that they need is a stabilized leadership group. They need clear direction. They need good policy to work from. And they need the resources to do the work, and that's, every day for the past, 3 years, that's what we've been doing, is coming to work every day with a very focused intention on supporting our staff to the best of our ability, knowing that we rely on those staff to support our clients. So when they identify that they have a training need, we say, okay, that, we think that sounds great. But how do we see that this training is embedded in how we deliver our service to make sure, right? So we can all sit here and say that everybody needs to, know how to do trauma-informed care. I would agree with that. Our services need to be trauma-informed. That's the important part. You can take trauma-informed care and then return to a workplace that hasn't embedded trauma-informed principles in its service delivery model. And so you as a human may have been enriched by that experience, but your clients haven't been because it's not being embedded in the service. So I think those are the key areas, because the common things that people often come back with are, we need more people, we need more support coordinators. And I would argue that before we look at having more support coordinators, we need to look at the way that we do our work and see where we can improve our efficiencies and ensure that, you know, we're really clear about what the expectations are. We've got good policy to work from. That, you know, we could spend the next 3 years of, the first 3 years of these recommendations only working on policy,
Yeah.
right?
Yeah.
But we don't have time to do that. So we're going to do policy and implementation at the same time. And, you know, that's probably a really good example, and I will turn this over to you. But when staff tell us they don't feel like they can read a policy and understand what they were intended to do, that to me was like, whew, okay, we need to do something here. So we've adopted a model where we have a policy and then we have an accompanying standard operating procedure. And when we go through the policy review process and have the policy approved, before it gets approved, staff have provided input into that. So it's a very iterative process. We're taking an existing policy and we're going to make changes. What are you hearing from your clients? Where are the gaps in this policy? Where have you seen frustrations? What can we do to enhance and strengthen the policy? So we update the policy, we develop standard operating procedure, and then we have something called policy chair, where we host a live town hall type session, and we share the policy, highlighting the updates, walk through the standard operating procedure, provide people an opportunity to ask clarifying questions, and then it gets rolled out, not until. So that's one piece of work that's really been very purposeful. It takes a lot of time, a lot of resource, a lot of effort, but it is making a difference. Our staff can feel confident in the decisions that they make, in the advice that they give to clients. I mean, it isn't, there's no sea changes here, right? Like, this is all work that's, you've got to be invested, and it's going to take time, but if we keep going and we keep making those investments and we do it in a purposeful way, we're going to get there. And I'm sure Anne has more to offer to this.
I will. No pressure, no pressure. Said a lot. I think what is important is when we hear from the clients that we serve, our community partners, and the ones that we're not able to serve because of the eligibility criteria, and we hear about their experience, and we look at the experience of staff. If we can meet our staff in the same way that we intend to meet our clients and deliver that service, with that same level of commitment, understanding everybody's a little bit different, everybody brings a different skill set, and then look at the service delivery, and truly embed it, that's where your systems change comes from. As Shelley mentioned with the training example, training is a wonderful thing. Is it changing your service delivery? How is it changing? And if we're able to have those conversations, it really does shift. It takes time. It takes time, and that's part of the change management process, and ensuring that we're engaging with staff in the same way that we're engaging with the people that we serve, because we need both. We come up with amazing reports, like the engagement, the outcomes, but the magic happens when staff are meeting with the families or the individuals, the NGO partners. That's where the change happens and the shift. And so if we can build that in, we'll have that systems change, but it won't happen overnight. But with the right building blocks, we should see some, we're already seeing some adjustments. Carla.
Thank you, Chair. Every time you give an answer, you give me more questions.
I should have stopped. So I really appreciate that answer. And because one of the things that I'm thinking about now is a client's involvement in this cultural shift. Because one of the things I hear often, and I'm not pointing fingers because it's not me involved, but I'm hearing, like we talked about earlier, I didn't even know I qualified for that. We've been sitting on this for 2 years. I've been struggling for 2 years. I didn't know I applied for that. I hear things about people not get, workers not getting back to clients in timely manners. They heard they were told they were approved in May and they still haven't had any follow-up, and it's the end of June. People who feel that they have been poorly treated by their workers. So I'm curious, will clients have a role in this cultural shift? Because if you're hearing either A, the same complaints about staff over and over again, or the same, not complaints, but the same issues that clients are facing, and maybe you're hearing the same things over and over again about one specific staff. So how will clients be involved in this cultural shift?
Yeah, I think clients were involved in the review, and certainly a lot of the recommendations are about improving the internal sort of machinery of the division and how it delivers the program. So I think clients have been heard from. It's not a one and done. I want to be really clear about that. We're currently undertaking a review of the Targeted Basic Income Guarantee pilot project, and it involved a client feedback session, and a survey. And so, as we, as a department, look to establish service standards, which is on our list of priorities, to develop and make very clear, both internally and externally, what clients can expect in their relationship with the department. To what standard. I think there'll be other opportunities for the public and clients to be engaged in that. And certainly, I can say with confidence that the community organizations that we work directly with often provide a great number of feedback to us that is a direct representation of client voices. And we're listening. So, it's one thing for them to tell us about that and us to say, yes, when we hear that. But we are listening. And we are making changes, and probably, I think our current leadership team, our supervisors, our managers in social programs who are supporting, 140 staff across this island in 5 different office locations, they all get it. And they all want to be part of a positive change, and they want to support their staff to be able to deliver the best services possible. So I think anytime that a client has feedback that they want to provide us, they can certainly reach out, and we read every word, and we do take it seriously.
Carla?
Thank you, and I appreciate that as well. So another thing that I hear often is the concern about staff who don't have any healthcare training, but are kind of dealing with health documents and health information. And so people have shared concern about confidentiality, they've shared concern about people not understanding that and being in positions to make decisions. So how will this review change that? Or the results of this review?
Yeah, well, first and foremost is that sort of more streamlined approach to providing services to the clients and applicants of this program in starting at front-facing. Like, so the first person you're going to come into contact with is a dedicated accessibility support screener. So that's the first person who's going to be supporting you, and they're going to be, helping you navigate the process to the assessment process, like the formal assessment process, with those clinical assessors who are social workers, OTs, and RNs. So they do have a good understanding of the health system, and they also have good relationships with healthcare providers. So, one of the recommendations is around an updated health report to ensure that the health report is accurately reflecting the type of information that we need, right? And that the type of information that allows us to make a decision. So we don't need to know everything in the kitchen sink if it isn't directly related to making a decision about someone's eligibility for the program. So how do we improve that form? And so we are consulting with and have consulted with people in the healthcare profession to come up with a revised healthcare form. With respect to confidentiality and privacy, we all have a responsibility on confidentiality and privacy, and it is an issue that we take, we consider very important to our staff and to our clients, and we have very specific measures internally, and everything from, we have a policy and we have a standard operating procedure, we do continuous education, we do all kinds of reminders, we have every quarter, I guess it is, every quarter, there's a town hall meeting with the Director of Social Programs, and all of our staff are engaged, and we've had participation level of, 85% and more staff. We have an agenda that's co-developed, and each agenda deals with those kinds of, applies to everyone kind of policies, like access to ISM and privacy and confidentiality, and how to report a privacy breach, and what are the steps to take. And simple, practical, everyday things that we can do to enhance people's confidence in our ability to protect their private information. And consent, is a really important piece. When people apply, we need to make sure that they understand that they are giving us their consent to reach out to other service providers to either exchange information, to validate information, to support their application process. So I think those are some of the things that we're doing, and none of our staff are making a medical determination. We're validating information that's been provided by a medical professional to us to ensure that it meets the eligibility criteria.
Caroline?
Thank you, Chair. Thank you for all the explanation for these things. Carol said it raises more questions. You'll probably be back.
So if you, just saying. But I want to talk a little bit about associate families for a moment. And so the concept of that home environment that's critical, and that's a great thing to see. And then I instantly see the benefit, and then I instantly see the challenge. And so as an individual, I may be assigned to a family, and I'm placed in a family, and then you have the risk of the foster parenting world, of the client is there for a short period of time and they're moved on, and yet they've developed a relationship rapport and so forth. So the success of this approach is as strong as the family's commitment. And so what are you asking of families? Is this a lifetime commitment until they can no longer care for me, or until I need to move elsewhere? Like, is this a permanent sort of structure that you're looking for, or is it a foster parent or foster family sort of model? And where do grand families fit into this? That's a whole other program we need to talk about. Okay.
Okay, well, I'll start and certainly look to my colleagues here for support, but I would say, we have an existing associate family model.
Okay.
So we have about little over 40 individuals who are placed with families, and some of those are historic long-term arrangements. Our I guess, previous and current model is that we had 4 community organizations who were responsible for recruitment of, identifying appropriate family situations in a community, and then responsible for monitoring and oversight. And so at one time, there were as many as 65 individuals who lived throughout the province being supported by these 4 community organizations, and now we're right around 40, and really we have 2 organizations that are active in this. And so one of the enhancements, or the future enhancements that we envision, would be updating what does that framework, what does the program really look like? So how do we identify, how do we manage risk? How do we ensure there's good alignment, right? So, is it, and where is the individual coming from? So that would be a consideration too, is somebody living at home with family currently, and then maybe there's a loss of a parent. And so they've already been living in a home-like environment, and maybe this family that's identified is a close connection, and that transition is easier, and maybe it's progressive, or maybe it's instant, and I think it would depend very much on the circumstance. So that framework and guidance will help us to identify what that would look like. Of course, we want to make sure there's safeguards in place, so regular check-ins to ensure, and we want to see the individuals that are placed in these families accessing day programming, so that they are still, fully integrated into community, socializing, and having regular peer-to-peer connections. So that's some of what I see. Jessica, Anne?
Sure. Yeah, so We do really look for long-term placements in this. It's not a short-term solution. Most of the associate families that we have are historic, like they have been there for years, decades. And so each of our community partners would also be, you know, when they're potentially screening in a new associate family, they're looking for a long-term commitment. It might not be a life, but they're not interested in someone that only has temporary support to access. It really is like a longer-term piece. And we have some really great kind of associate family coordinators who get to know those families really well and get to know their supports well. And the introduction is quite slow and intentional about meeting the client, potentially seeing if there's fit. We also find in associate family programs, these types of home sharing across the country, really, you're not often recruiting somebody who has no connection to the individual or the sector. Oftentimes they are someone that maybe they were an EA for this person in their elementary and they retained a connection. Maybe it's a cousin, so oftentimes they already have some connection to this. That's where we find the best long-term matches, where there is kind of a long-term connection, or they're employees of our not-for-profit sector that are looking for that additional like income and an additional way to kind of give back to the community. So really they're stable, connected homes or homes with connections that are long-term placements, but they may be used in time gaps if they are someone that now is requiring group home support and maybe they can't be at home because their aging caregiver has, you know, had a health issue. So then we might look at them for a 3 to 6 month solution in those situations. But that would be like a step up or next level of care or those things. But they really are kind of a long-term support. And some of these folks really need minimal supports to live successfully in communities. They just need those extra check-ins, safeguards, and meals. And if you really want to live in your chosen community of Surrey, having someone trained to support, having really good systems and support to allow you to be successful there, where you feel comfortable, where you can walk down and see your uncle later today, can be a really meaningful service offering for sure. But it does take some early investments in getting the program set up.
And I would say the other piece that we're thinking about is the connectivity to other supported housing options. So if a placement breaks down, if there's a need for a temporary relief situation. So, you know, if we think about up in Surrey at the Harborview Training Center, they've just opened a new supported housing facility. And so they have a bed in that unit that is specifically for respite. So they can support people who access their day programming services and potentially others, and could be expanded to consider associate families where there's a regular opportunity for that caregiving support to be in place.
Chair, may I ask a clarifying question before I go on to my next question?
You sure can, Carolyn.
Thank you. So my clarifying question would be, associate families, is that in place for adults only?
Yes.
Yeah.
Okay, there was my misunderstanding. Thank you, Chair.
Carolyn.
Thank you. When we look at residential services, I'm a bit surprised to hear that the monitoring may not have always been there. And so talk to us a little bit about how quickly we can get the license or the licensing monitoring in place. Was a huge assumption that I had, that beyond fire and health or fire inspections to make sure that the smoke alarm worked, that there were things happening to make sure that people were getting what they needed when they needed it. And so that for me feels like a pretty big priority area, but where does that fit in your action plan, and how quickly can we see those legislative changes and actions to ensure that those homes are being inspected?
It's a big priority for us as well.
Okay.
And I think like our approach to this is that, one, it needs to be, we don't want to create something and then try and, you know, just come in like Big Brother and
Right.
ram it down people's necks, right? So our intent here is to co-develop a set of service standards that will act as an interim standard to work from. And so our community partners are aware of that. They've been well, you know, engaged in this conversation. They also, as Jessica indicated earlier, they welcome the opportunity to have that transparency. So we envision, like, this is in our year one, sit down, get these conversations going, start to develop those co-developed service standard. And at the same time, we need to explore what's the best place for these standards to be held and to be overseen and enforced and monitored, right? Because in some ways, it doesn't seem like it's appropriate for our department to be both the carrot, the funder, and the stick in the monitoring, right? So what we're kind of looking at is where is this service best placed? Is it alignment with existing community care and long-term care facility board inspection type role? Is it, there's tourism licensing and inspections? Is it something we can do with EDSA, with our, would they have an interest? And so how do we get there, right? And we don't have the answers to that at this time, but it is an active, prioritized conversation for us and something we feel is absolutely needed. We have had some smaller, like small options type arrangements that have been created over the past few years that we've provided guidance to as a, looking at other jurisdictions, what they have for service standards and coming up with something that's an interim that can give people a place to start from for consideration when they're looking to bring proposals forward.
I think it's important to note too, it's not, we don't have formal structures in place, so it doesn't mean that we're not monitoring on an ongoing basis,
Yeah.
meeting regularly with our community partners and those things too, so, but it's certainly a concern.
Formalized.
Yeah.
Carolyn?
Thank you. I would just offer up the Department of Education and Early Years has the Early Learning and Childcare Board that does the licensing, monitoring, inspections, and the department is the funder. So there's another model to look from.
Yeah.
So that was just a comment. So my question would be.
It's very strict around here.
Yes, very. That was just a comment, no question. So one of the things that that I see in here that I'd like to understand a little bit more about is a new capital infrastructure funding process. So you talked earlier about as people age and so and growth and complexity of what we already know in terms of the people that are being diagnosed with more and more complex needs, younger and younger. So as you plan 10, 15, 20, 50 years out, and I know but people will age into service that, what are we looking at from a capital infrastructure point of view right now and into the future?
Yeah, so all of those, the current community supports, the housing-related supports, the day program, they're all owned and operated by community organizations. So we're looking at how do we support them in expanding their services. So, Stars for Life recently had a major expansion to their day programming service. So government invested in that, right? Provided a contribution. Right now, there's no formal sort of application to complete or process to follow to seek that support, right? So what we're looking to do is put some parameters around that. And when we say capital investment, it could be everything from like a roof repair of an existing facility where an improvement is needed to an expansion, right? So Harborview Training Center, their transitional housing, we were a major partner in the development and funding of that project. But these are very much community-run, community-grown, community investments, and we see our role as understanding how can we help. There's the infrastructure piece, and funding, but what else can we help with? Is it connections to other departments and agencies? Is it helping with application forms? What is it the role for us? And we too see that need in the future, and we want organizations to be successful. And but right now we don't have a formal process for people to ask us. So it's very random, and it's very much dependent on budgets in the moment. So we feel there's a need to get to a more sort of open and transparent process.
Thank you. Do I have one more?
You don't, but I am going to do a rapid fire if you want.
Okay,
I can
I'll
put you
start
back
the
on
rapid
list.
fire if you'd like.
Okay, all right, well, let's go there then.
Okay.
The rapid fire questions, we'll get one more from
Okay,
whoever
so
wants.
going forward, so this has been very informative, really sort of see high level, bird's eye view, sort of your path forward here. What will be the public facing communications out to clients, to organizations, to community, to this group, others, that will address how things are going, and how often will you be double checking back and assessing how's it, what's your plan for assessment as you move through? Because you'll need to pivot. It won't all be perfect, right?
Yeah, and I mean, if this is looking at 5 years of implementation of recommendations, and we don't have a 5-year budget to go along with that,
No.
right? So we needed to prioritize the items that we would address in years 1 and 2, and we have gone forward and gotten our year 1 budget commitments identified. And so, as the budget management cycle approaches in the fall of the year, we'll put forward our prioritized items for
Yep.
fiscal year 27, 28, and so on and so forth. But our intention is to have a comprehensive identification of all of the recommendations, all of the actions, detailed costing, and we're going to put them where we believe they can realistically belong, so year 1, 2, 3, 4, and 5. And in terms of how do we see reporting back to our partners and the public more broadly, at the very minimum, we'll be doing an internal sort of report card on progress on these reviews. And, we'll have to explore a bit about what people have an interest in seeing. We've been really open and transparent about this process all the way through. If you look on the website, probably, we had a very interactive website where we had our What We Heard reports published, and, certainly our intention to keep the public advised and to keep our partners advised of the progress that we're making.
Carla?
Thank you.
Thank you, Chair. So you may have answered this through a different question.
Sure. But I'm gonna ask it just in case you were talking about something else, but the review work streams, under residential services, one of the things you talked about was looking at the wait list for services and residential placements of community partners. And so my question that I have about that is, what if community partners do have really long wait lists and they don't have capacity? Is that what you were kind of referring to in response to, because it's more than just infrastructure, right? It's much more than just infrastructure.
Absolutely.
So when you talk about looking at that, what's your response to that? What can you do about that?
Yeah, so one of the things that we talked about, having a consolidated prioritized wait list, is really looking at the prioritization of who's most in need. So if you have a finite resource, you really need to have a fair and transparent way of giving people access to that resource, right? So I think our partners are also sort of enthusiastic about knowing where the lay of the land is. And this is related to our funding model in that right now, we may have a funding commitment with an organization, and they may have 3 individuals exit their program, but we're not necessarily aware of that. And they may be taking, 3 new people into the service, and meanwhile, we've got this number of people over here that are calling, and they're in urgent need of a placement. So the idea would be to have a framework that allows for information sharing in real time that tells us when a placement is available, whether that be a day programming space or a supported housing option, so that the people who have the greatest needs can have access to the service first. And, we know, like, the geography will be a player in that, there may be a seat or a bed that becomes available in Charlottetown, and the family lives in Surrey, and they may not be willing to take that, and that's okay, as long as that person can be cared for safely until something else becomes available. That's sort of in the here and now of what we have, but then it's this, what does the long term look like? And how do we work with partners and engage to look at service level expansions? And things like associate families are a part of that, right? To have more options within a continuum of services. You probably have very detailed information on the prioritized wait list.
I'm not sure how detailed you want to get. But
Not that
I'd love to
detailed.
talk sometime. So I think this is, you're identifying a critical link between this and our core funding and capital investments, and how we get better information about. Maybe there's a service provider that wants to start a exciting new thing in Summerside, but we don't have a demonstrated need in Summerside. So is that a great source of our funding if we know that we have really high needs in the Montague area? And so What we've recommended under the waitlist and prioritization stream is a provincial waitlist framework. When people meet a certain criteria, they would come onto the provincial waitlist and really be prioritized across the services. If they don't quite meet that threshold for need, and we don't have anyone on the provincial waitlist that's kind of up here, that's managed by our residential services social worker, who's very great at supporting placements and families and navigating those systems, then we would have these other folks who are having their needs met within their communities and within their direct organization if there's no one kind of in this high level band. But what we also find is this wait list that Shelley had talked about earlier that has 200 people on it. A lot of them are saying, when I age, I'm going to need a place. And so they're putting their loved one on these wait lists, but they don't actually have an urgent need for care. So the wait lists aren't actually reflective of what our true needs are. And so in order to kind of make sure that our wait lists accurately reflect those who are actively looking for services, we've also decided to implement a planning registry. So this would be to give kind of peace of mind and support to those family members that are saying, I'm going to need services down the road and I'm going to need them in Surrey. It's really critical to me that this, family member stay here. And so I think we were kind of trying to align our thresholds with our planning, with education planning, that they're starting to do kind of our, I think it's around 14 maybe, that they're starting to do that kind of post-school planning. So at that time, they could come onto our registry and they could document what their support needs are, what their prioritized communities are, and so that we start to get a really great data and picture of who's coming into the system, where the needs are, that's going to be able to inform our capital process, and also kind of reduce the pressure on our wait list to make it more accurate and allow us to kind of flow folks where they need to go. And we do have a really wide range in the support needs that can be met in those group homes in that system. So if this is a wheelchair accessible group home that's a high cost, high value space, we really want to make sure that it's matched with someone that has those actual support needs and is at the top of the list. So I think all of these improvements, which are already, we're already testing our new notice of vacancy system, we're already implementing this, we're well down the way on this implementation of these recommendations, but they will allow us to build that kind of future-proof system and make sure that we're well supported in the coming years.
Hilton. Oh, you're good. Okay, I think I've exhausted my list and we are kind of running out of time, but I do have one question myself. And that was that yesterday when the folks from the Department of Education were in, they talked about the collaborative approach across multiple different departments. And I wondered if bringing it to a level of kids under 18 in disability support, I wondered if you had any information on how that might look when we look at those little people that are, little and big people, that are in our school system, and how perhaps maybe teachers, school counselors, administrators can find those right supports for kids within our school system. Do you have any idea what that might look like through your department?
A couple of things. The committee that they're referring to are the Children with Complex Needs. It's being organized and coordinated through Executive Council Office, and we're participants. Actually, I'm on the steering committee and Jessica's on the operational committee. So we're really engaged in that work, and we feel a little bit honored. What does that, when someone does something that you've done, it's the highest form of flattery.
Yes.
Anyhow, because we had already initiated a table for adults with complex needs, and we had brought together education, justice, public trustee, public guardian's office, healthcare, Department of Health and Wellness, housing, and ourselves, and we had already been meeting for months on ensuring that we have the right framework in place should an emerging issue arise with existing placements. So the committee and its work is a little bit limited in its scope of existing placements, but certainly we've got good connections established and good flow of communication, and we can come together as needed when a situation arises within one of those placements that can put the right supports in place. And then further, I would say, our staff are involved in that transition planning and looking at what takes place after school, right? So as the formal school years wind up, what supports and resources are available to individuals in the community, and we are actively engaged in that work as well.
I just want to add too that for some of the children that access our supports and services, their needs may not be as complex, and staff are able to attend school meetings if the family would like them present to problem solve with, sometimes there's, as you would well know, teachers, EAs, could be school-age autism consultants, and do some of that support planning with the funding pieces. So it doesn't always have to be more of those nuanced or complex cases. That does happen.
Yeah, I think our school counselors do a great job too, and they are hands-on with families, you know, daily, weekly, and to ensure that they have the supports that they need. So, okay, I think that's the only question I have. Although I have a ton of little jot notes around because I was so excited when you guys were talking. I definitely feel the energy in the room from you and how you feel like things are really starting to get underway. But it leaves me with two statements, and one is my parents used to say, you can't build a house on sand. And I feel like the foundations that you're putting in place in a number of areas, whether it's stabilizing leadership, whether it's empowering clients to do what they can and only insert supports when needed, whether it's the communication piece that you talk about, whether it's the application piece, it's, you know, a number of those things where I think that foundations need to be in place so that you can build upon it. And I think you mentioned building blocks too. And the other one that I wanted to say was that we can't fix what we don't acknowledge. And throughout your presentation, I heard a number of times of the fact that you're listening and you are learning and you're implementing. And for the people that live in our province, I'm happy to hear that they're going to get the supports that they need, and if they're not there, then you're open to listening to how we can create meaningful change. So with that, I will thank you on the behalf of our committee, and thank you for all the great work you're doing. Honestly, I feel like, whew, this is so exciting. I wanted to jump in. I had my sticky notes everywhere to say, and. So thank you all for coming, and we will, I think that we'll continue on as you guys pack up, because I don't believe that there's probably any new business. Oh, wait. Spoke too soon. But thank you all for coming.
Yeah.
Thank you.
Thank you.
You might be interested in new business.
Yes. Or not. Is there any new business? Carolyn?
Thank you, Chair. Given the presentation that we've had this morning, and given that it's while we're in year one and work is just beginning, I think it would be really important for us to invite the presenters back X number of months out to get a status update, progress update, the lessons learned, the challenges they're facing, whatever it is. But that's specifically what I would be interested, helping us stay as informed as we are on their progress.
Does the committee have any discussion? We're good? Okay. Anything else for new business?
Can I,
Oh,
sorry.
yep.
Can I clarify if
You
that
sure
would be
can.
a fall 2026 item or winter 2027?
Winter 2027 seems reasonable to me. They've talked a lot about just getting started, so the fall might not have a whole lot new for us. So, but that's open. Winter would be fine with me.
Okay. Anything else for new business, Hilton?
Yes. Should have said it last time with the work plan. I would really like to see us dwell into the issue at Slemon Park with the water, the PFOS levels. It's coming up to 2 years. There is some work being done, but it really seems to be dragging quite a bit. It's mostly a federal issue. Apparently, when they turned over the property from CFB Summerside to Slemon Park, but Department of National Defense has quite a stake in this. It falls under a lot of their jurisdiction, given that they did put a substantial amount of money into North Bay to clean theirs up. Something like 120 million went into North Bay to fix the problem, same problem. And it just seems to be dragging on a lot, so.
Do you have any idea who you might like to, I assume this is a briefing that you would like, and is there someone that you might like to bring in?
Well, we can find out what Slemon Park has been doing, I guess, is one. There's a Kimberly Stevenson, and she's the director of contaminated sites. Now, that she's she's been in contact with Slemon Park, but I mean, word that I'm getting that it's seems to be moving slow. You know, if it's the PFAS levels are quite a bit higher than the national standards, so there's a lot of concern, and I think we should find out, like, why is it taking this long to solve this situation? Apparently, when the precedent has been set in another jurisdiction in Canada.
Anybody have anything they'd like to add? So I'm hearing that you think that two possible people that we could invite in would be Kimberly Stevenson and the Slemon. Is there a corporation at Slemon Park?
It's a
Slemon.
corporation, yeah.
Okay.
And I don't know whether there's anybody else. Like I said, that's the only name that I've heard has been contact with Slemon Park is Kimberly.
She's with the federal government.
She's with the federal.
Would you know what, with Department of National Defense?
She's the director of contaminated sites. Now, I don't know what quite that falls under, but it is under Department of National Defense to look after. They're the ones who did the settlement with North Bay, Ontario.
Do you have anything else you'd like to ask?
So is the committee wanting a letter to go to Slemon Park and the Department of National Defense? Just Slemon Park to get their update on what has been happening? And are we wanting a in-person consultation or a written submission to start?
They have, Slemon Park has sent letters out to the residents and tell them what's going on. So I don't know whether a letter would just be fine, that situation. Everything, ask them everything they've done and so far. Like, it's about a year and a half since they had their public meeting, and I'm pretty sure the feds were there and the provincial government was there, but I mean, like I said, that's a year and a half ago, so. Unless they want to reach out to the Department of National Defense, just to see if there's anybody that, and how they handled the situation up in North Bay, or.
So letters to the Slemon Park Corporation and the Department of National Defense looking for an update.
Well, yeah, but I'd like to see them come in, and why is it taking this long?
So just so that our clerk is clear.
Yeah.
Do we want to send a letter, or do we want to invite them in for a briefing? Even if it means that if they aren't here in PEI, we can stream them in.
Mm.
So do you want the clerk to schedule meetings
I
for
wouldn't
the
mind
fall?
for the fall, yeah, just to, and hopefully it's taken care of.
Well, we're all out of meetings for now.
I know.
But we can certainly, is it okay with the committee that we add that to the work plans? Okay.
And sorry, then is a letter to Slemon Park Corporation also required to have them come in? Or this is just the department, the federal government?
Doesn't matter, you know,
Would you like to be able to ask them questions?
we can ask, yeah,
Okay.
So,
yeah, I guess so, probably. Just to, I guess I know the situation, but I mean, other members might have some questions, for sure.
Okay, perfect.
Carolyn?
Thank you, Chair. I apologize in advance for my question, but I'm wondering on the work plan, do we have something on there related to grand families and the grandparents group? Okay. If not, the grandparents are organizing, are looking to have nonprofit status soon and so on and so forth, but I would like to see if we can learn more about what's happening through social development and seniors in the grandparenting program, what that looks like, what that feels like for grandfamilies, from both the department's perspective, but from the organization's perspective as well. Because from what I hear, there's a disconnect between what the department believes is strong and working for grandparents and what grandparents are living. And so this is grandparents, just for clarity, who are raising their grandchildren. and a growing reality. So both the organization and the department, if the committee's open to that.
Is there any discussion on that? I'm looking at it from a committee report level of if you have both people come in, it helps to strengthen our report, so.
Is the Building Grand Families, Inc., is that the organization?
It is,
Okay.
and there's, I believe there might be a new email, so I'll have a look at that, Emily, and get that
Okay,
to you.
that would be great.
Yeah.
And the department to specifically talk about what supports are being provided
Exactly.
for grandparents who are raising their grandchildren.
Exactly.
Okay.
Thank you.
Perfect.
Thank you, committee.
All right. Anybody else have any new business? All right. Can I get a motion to adjourn this meeting? Thank you, Brendan. Oh, he's observing. I thought he might have been, so I was kind of looking. Thank you, Carla.